Welcome to this NCFE video focusing on maximising success in the Employer Set project for health. Some of the types of assessment mentioned in this video may change in future Employer Set projects, but the types of tips provided for each type of assessment in this video will be relevant for future Employer Set project assessments. The Employer Set project requires students to apply and contextualise core knowledge through the demonstration of the following core skills: person-centred care, communication, team working, reflective evaluation, researching and presenting. These are demonstrated through the completion of a number of tasks. These include a report, a role play, a contribution towards a healthcare plan, a presentation and a reflective account. So firstly, looking at task 1, the report. In this task, students are required to synthesise research they have undertaken to describe how to best support an individual from a provided case study. The core skills covered in this task are person-centred care and researching. To maximise success in this type of assessment, students should make links to relevant evidence-based practice, theory and policy. It is important that students then relate the information gained to the individual from the case study and discuss how they could apply this evidence-based information to best support the individual. They should also use numerical details such as percentages, graphs, tables and numerical statistics. It is important that students use the numerical details to justify the support they are discussing for the individual with logical reasoning. Students need to analyse how the information could be used to effectively support the individual and not just simply include the information as it is related to an individual's condition. They need to also reference communication barriers and justify any support required. It is important that students understand communication barriers within health and how communication and support provided may need to be adapted or additional considerations taken into account when providing support. This will help to justify the support when referencing potential communication barriers. Task 2A, which is a role play. In this task, students are required to undertake a discussion with the individual from the case study to inform the next steps for their care. The core skills covered in this task are communication and person-centred care skills. To maximise success in this type of assessment, students should ensure they include greetings and introductions. This helps to set the scene for the discussion and provides a supportive and person-centred environment. Students should provide a clear introduction of their role and what they aim to achieve together with the individual from the discussion. Students need to also gather the appropriate amount of information from the individual to support in creating an effective care plan. It is important that students do not just ask questions that could already be answered from the case study. They need to be able to ask additional open-ended questions about what support is required, what the individual's health concerns are, the individual's choices, their preferences and/or values, the individual's needs, their goals, both short and long term. Questions that are asked need to be well considered about what information they would like to gain to help them to inform their care approach and explore options for next step. This will help them to support them in having the relevant information to create a healthcare plan in the next task. Students also need to understand their role within this task. The student's role is of a support and healthcare assistant, and the aim of the task is for them to conduct a discussion with an individual to inform the next steps for their care. It's important for them to remember that they are not a GP, so they should refrain from mentioning about prescribing medication in the discussion, as this is outside of the responsibility and professional boundaries of their role. If other professionals do need to be involved in the care of the individual, then the students should respond to the individual advising this. For task 2B, which is the healthcare plan. In this task, students are required to contribute to a healthcare plan for the individual. The core skills covered in this task are communication, person-centred care skills and team working. To maximise success in this type of assessment, students should ensure they include a time frame for plans and reviews. For any actions of support included in the plan, students should include a time frame of when this support will be provided and when a review of this support will be undertaken. It is important that review dates are included, as within healthcare, needs may change and healthcare plans may need to be updated and/or changed to reflect these changes and requirements. Students should also include identification of risk and safeguarding measures. For any actions of support included in the plans, students should include the identification of any risks involved in the support and safeguarding measures that would need to be put in place to ensure the individual is protected from harm. Students should also understand how to create and structure a healthcare plan. Students need to understand how they effectively create and structure a healthcare plan, as there are different types of healthcare plans used within the health sector, within different organisations. It's recommended that students view them and what's included on them and practice creating and structuring healthcare plans prior to undertaking the employer set project. For task 3B, which is a presentation, in this task, students are required to conduct a presentation to a senior colleague in the healthcare team. The core skills covered in this task are communication, reflective evaluation and presenting. To maximise success in this type of assessment, students should include information about any changes to the healthcare plan based on the feedback. It is important that students not just repeat the healthcare plan information, as one of the core skills covered in this task is reflective evaluation. Students need to be able to show how they have reflected on their own practice and made improvements from their own experiences and feedback provided. Students need to also consider who the audience is they are presenting to. It is important that students understand who their audience is when presenting, which in this example is a senior colleague. They should adapt their communication and presentation skills appropriately to ensure that the language and tone used is professional and formal. If they write and present their work, if it is someone who doesn't work in the sector, then they will not be appropriately communicating and presenting their work to the relevant audience. They will therefore not be prepared to answer follow-up questions from the senior colleague. So moving on to task 4, reflective account. In this task, students are required to complete a reflective account. The core skills covered in this task is reflective evaluation. To maximise success in this type of assessment, students should understand what reflective writing is and how to write reflectively. Prior to undertaking the ESP, students should be introduced to reflective writing and models of reflection to aid in the understanding of what to include when writing reflectively. Students need to avoid writing descriptively and ensure that they effectively evaluate their performance, including on reflecting on what went well, what could be improved, and further developments based on their own experiences and feedback gained throughout the tasks. They also need to reflect on their own performance against the project aims and objectives, including their strengths and limitations. English, mathematics and digital skills are one of the assessment objectives for the Employer Set project, and students need to be able to demonstrate the use of these skills appropriately. Some top tips therefore are ensure they proofread or work for spelling, punctuation and grammar errors. Some common errors for students to check include having capital letters on proper nouns, the correct use of apostrophes and using commas to clarify meanings. Students should reference any sources of information they use appropriately, including numerical information. They should also proofread presentation slides and any written information to ensure it's structured and formatted correctly. They should also utilise digital presentation aids other than just PowerPoint slides. To maximise success in the Employer Set project, these are some general top tips for students. They should use all pro formas that are provided for the tasks. They should proofread all tasks for spelling, punctuation and grammar errors. They should practice reflective writing skills. They should read all tasks thoroughly to ensure a full understanding of the requirements of the task. They shouldn't rush through roleplay tasks. They should ensure they have enough information gathered to create an appropriate healthcare plan. For each task, they should include any relevant information from previous tasks and avoid treating the task as individual assessments. The employee set project is a project and each task follows on from the previous task, so it is important to make relevant links.